Hospital workers, serious. What regrets do you hear from dying patients? Asterisk asterisk attention. Serious. Tag notice asterisk asterisk. Asterisk. Jokes, puns, and off-topic comments are not permitted. https www.reddit.com/r/askreddit/wiki/index #wiki_rule_6- in asterisk any asterisk comment, parent or child, asterisk parent comments that aren't from the target group will be removed, along with their child replies. Asterisk report comments that violate these rules. Posts that have few relevant answers within the first hour, and posts that are not appropriate for the serious tag will be removed. Consider doing an AMA request instead. Thanks for your cooperation and enjoy the discussion. Asterisk I am a bot, and this action was performed automatically. Please contact the moderators of this subreddit. Messaged compose to E=R ask Reddit. If you have any questions or concerns. Asterisk. He wished he had been a better father to his daughter. He wished they had reconnected. His dementia prevented him from remembering they had reconnected years before and that she visited often. I wish I could have made him aware that he had accomplished his last wish. But he died not really understanding that. I worked as an oncology nurse right out of nursing school. I was barely 21 years old. Had a patient about my age who was dying of lung cancer. A few hours before he died, I sat with him and he was telling me how much he wished that he would have had more time to maybe fall in love, marry, have kids. He was so young. He asked me to call his parents and he died shortly after they arrived. It was awful. His regrets were more about the life not lived. Many older patients had some interesting life stories and most wanted to tell them before they died. Most were at peace with the life they lived. Many regretted working so much and not spending enough time with family. Removed. In the air, it's not something most people see coming when they arrive, but it's usually the same regret when they are coherent. They all wish their family was there, which sucks even more lately with COVID since family can't come in initially, or they cry out for their so in a panic. It's gotten to the point recently where we tell them, "So is right here with you." The look of relief on people's faces just hearing that gets me every time. People just want to not be alone at the end. I was a new nurse, flying solo. We got a call for an incoming trauma woman in her 50s involved in a multi-car accident. We were already at the ambulance bay, unsure of the woman's complete condition. She rolled in breathing on her own, but very labored with asymmetrical chest expansion. She was profusely bleeding, had multiple deep lacerations, pupils blown, debris covering most of her, etc. Her vitals were unstable. She was circling the drain. We knew she was on the verge of coding. I was standing near her head, ready to assist in supporting her airway but also providing comfort and doing my best to calm her. The woman looked me directly in the eyes and in a hoarse, labored voice stated, "I was angry." I told her I was disappointed in her. She began to cry. Her vitals plummeted. "I'm sorry," was the last thing she said before her heart stopped. We coded her, intubated her, performed round after round of ACLS, only to eventually have to call time of death. I still see her face at times. Her eyes filled with more emotional pain than physical. It took much longer and was so much harder to write this than I thought it would be. Removed. I work in a hospital. Whenever someone is at the end of their life, they always just want to be with their loved ones. Any regrets I've heard is always family related. They wanted more time with the people they love. Most people are at peace with things though. People also tend to wish they took their health seriously. I was a hospice nurse. One of my elderly patients had skin cancer, a huge malignant melanoma on the side of his neck that was growing rapidly. He had been a farmer all his life and never married. One night we were talking and I asked him if there was anything he wished he had done differently in his life. and he thought about it a minute and said he wished he had worn a hat when he was farming. I wish he did too. My mother-in-law, her husband, stepdad to my husband, would not leave her alone in the hospital for 1 minute. He is a controlling, crazy man. My husband was visiting and somehow she convinced his scrap dad to go take a break. She pulled my husband, her son, close and said, "I don't want to be kept alive on machines." Her husband was her power of attorney, so my husband had no power. She was kept alive way longer than needed. I think, in the end, she regretted trusting Hi Monsieur, end-of-life physician here. CPR. No, seriously, hear me out. Imagine using your hands to crush the sternum down 2 inches repeatedly of your 90-year-old grandmother who weighs 90 pounds, so that maybe you can then put her on a ventilator from which she might never get off alive. We ask this of everyone who comes into the hospital, but too often it's asked more like, "Hey, if you're drowning, do you want us to save you?" rather than what it truly is, especially for those who most likely won't survive it in the first place. And if they do, will be significantly worse off than they were before they died. The survival statistics for patients with 1 to 2 significant comorbidities with an in-hospital cardiac arrest is like less than 5% to leave alive, and then 30-day survival is 5% of that original 5%. If I remember correctly, I cannot count the number of times families were adamant on having it done to their loved one only to then see what it entails firsthand and beg us not to do it again. I did training to be a CNA and we had to work in a nursing home as part of our training. I didn't really get into any deep conversations with the patients there. But I can say this. If you have family in a nursing home, please visit with them, monsieur. It's a sad and lonely place to be. I've taken care of a lot of COVID patients. Seen a lot die. I had a lady who lived in an adult family home. She was 100% cognitively sound. Her adult family home had a COVID outbreak and she caught it. She spent weeks in the hospital and eventually was put on end-of-life care because she declined. She was kept heavily sedated on a PCA pump to ease her transition. One night, I heard her IV beeping and it was that line occluded alarm, monsieur. When you work with a dying population on these pumps, you learn the occlusion alarm will sound when the patient dies. This is because there's no blood flow. There I stood, outside her door, listening to the alarm, monsieur. I sighed and told the nearest CNA to wait by so I could tell him a time of death. I don my PPE and go in, and she's still alive. So I restart her pump and stand there a minute, listening to the hum of the HEPA filter. I realized throughout her entire stay at the hospital, she wasn't allowed a single visitor. She's gone through this entire experience alone. I grab a warm washcloth and start wiping around her eyes. The moment the warm cloth touched her skin, she whimpered and leaned into me, then sighed deeply. She opened one eye and gave me a very quiet, very slurred, "Thanks, daughter's name. I should have spent more time with you." I left the room and cried for the first time since the pandemic started. She died a few days later. Removed. I remember of this 40-year-old patient that I had was dying from breast cancer that spread throughout her body. She was diagnosed with breast cancer 10 years earlier and had a mastectomy. The doctor recommended for her to have a bilateral mastectomy with reconstruction due to high risk of recurrence of cancer. She said that she wanted to keep her breast, a real breast rather than an implant, in case she remarries and will be somewhat whole. She regretted not getting the bilateral mastectomy. If she did, she would not gotten cancer in her remaining breast and dying at such a young age. The patient never ended up marrying after all. A week later, I was diagnosed with breast cancer. I instantly told the doctor that I want a bilateral mastectomy with reconstruction. I also had an aggressive form of cancer. My doctor kept pushing a lumpectomy, which I probably would have gotten before I have heard how much she regretted her decision. I feel that she actually saved my life, sharing and opening up with her regret of all time. Edit. Thank you all so much. I thought this would just get buried. I pray that the ones facing breast cancer will recover, and my prayers are with you. You are not alone in this. I was 48 years old at the time of my diagnosis and have been cancer-free for the 10 years now. I think of that lady often. She was a mother of 5. She was a true blessing to me. She was my last patient on my last shift prior to getting my results and starting chemo. If it wasn't for her, I know I would not be here. Edit. I had grade 3 HER2 breast cancer. I've worked in long-term care for over a decade. I can't speak for the young, but most often old people regret the things they didn't do. Removed.